In this lecture, we're going to look at the blood vessels and hemodynamics. In general, blood vessels have three layers or tunics. The first one is the tunica intima or tunica interna, and of course that's the innermost layer. And that's going to be adjacent to the lumen. Lumen is the opening. And then the middle layer, the tunica media, we're going to find smooth muscle and elastic fibers. And then with the tunica externa, it's of course the outermost layer and it's adjacent to the surrounding tissue. And it actually helps to kind of anchor the blood vessels in place. And so we can see here the difference between an artery and a vein. Arteries are high pressure systems, so they tend to be much thicker. Veins are low pressure systems, and they're quite a bit thinner. When we're looking at the body, if we're looking at a cadaver, for instance, the arteries tend to be very firm and very round. The veins tend to be flat and floppy, again, because they're low pressure systems. Matter of fact, under the microscope, when we're looking at arteries and veins, the artery, again, is very round, where the vein is very irregular and flat shaped. And then we have capillaries down here. And capillaries are basically endothelium, so single squamous epithelium, with a basement membrane to help attach it to something. But let's take a look. Here's the tunica interna or tunica intima. It's made up of endothelium. We have a basement membrane, and then we have the internal elastic lamina. So all of that makes up the tunica interna. Kind of looks like a sandwich, doesn't it? You have your meat, some American cheese, and some Swiss cheese. But anyway, then we have the tunica media, and that's made up of smooth muscle. Smooth muscle, if you remember, is involuntary. When this constricts, we get vasoconstriction, which can help shunt blood away from areas. It can also raise blood pressure if it's hitting the more systemic vessels. Or if it relaxes, we can drop blood pressure. Or we can get more blood supply to an area. Like, for instance, if there's vasodilation, maybe in the face, we'll get more blood flow there, and you might blush. Okay. So the tunica media, besides smooth muscle, also has an external elastic lamina. And then finally, we have the tunica externa on the outside here. Now, with the veins, we have the same stuff, but pretty much less of it. So we have, again, the endothelium, which is simple squamous epithelium. We have the basement membrane, but we don't have an internal elastic lamina. We have a very thin tunica media, so just a little bit of smooth muscle, and no external elastic lamina, and then finally the tunica externa. But the one thing veins have, I gave it away. One thing that veins have that arteries don't have are valves. Because veins are low pressure systems, then blood gets kind of pushed up, kind of oozed up, and it's going to settle back down. In order to keep that blood moving toward the heart, we don't want it to all just drain out, otherwise the blood will just pool. So we have valves that help to stop the blood from going backwards and pooling. Okay. Now, the order from largest to smallest, we start off with arteries, then we go down to arterioles, and then arterioles will become capillaries. Okay. And I guess I can keep going with the venous system as well. So arteries to arterioles to capillaries, to venules to veins. So we just went from largest to smallest back up to largest again. But the arteries and arterioles under the microscope, again, you could see how nice and round this is, as opposed to a vein, which would be very flat and irregular looking. But see this that looks like little stitching. Okay, that's your internal elastic lamina. Out here, again, it looks like stitching, and that's going to be the external elastic lamina. And the tunica externa is a part of that. And then here's the tunica media, which again is going to contain some of the smooth muscle. The lumen is the opening here. You can see some blood vessels in there, or blood cells in there. And then the endothelium would be the innermost layer. Okay. Now, arteries, as we mentioned before, carry blood away from the heart to the tissues. The walls of the arteries are elastic, which allows them to absorb pressure created by ventricles of the heart as they pump blood into the arteries. As a matter of fact, the aorta is what we consider a large elastic artery. When the ventricle contracts, that aorta balloons out, and then, of course, being elastic, it rebounds, and that helps to push blood to the rest of the body. Also, because of the smooth muscle in the tunica media, arteries can regulate their diameter. As we said before, it can allow more or less blood flow to certain areas or certain organs, and it can also regulate blood pressure up and down. If it constricts, blood pressure goes up. If it dilates, blood pressure can go down. Now, the types of arteries, we have the elastic arteries, which are conducting arteries, large diameter, more elastic fibers, less smooth muscle, function as a pressure reservoir. Again, the big E with that is going to be the aorta. Then we have muscular arteries. These are distributing arteries. They're medium diameter, more smooth muscle, fewer elastic fibers, and they're going to distribute blood to the various parts of the body. Here we see arteries as pressure reservoirs. So we have the elastic aorta, and arteries stretch during ventricular contraction. And then the elastic aorta and arteries recoil during ventricular relaxation. Again, that just helps to push the blood along. Okay, an anastomosis. An anastomosis is the union of the branch of two or more arteries supplying the same region of the body. Now let me clarify this term for a second. The reason, the definition is it's the union of the branches of two or more arteries together. That's because we're studying arteries right now. An anastomosis is really the connection of two or more tubes, which means, you know, suppose we have to take out some intestine, okay, and maybe reroute it, do like a gastric bypass or something. Well, we can create a surgical anastomosis by taking the one tube, the one part of the intestine, and moving it down the line and attaching it to another part of intestine. Okay, so that would be an example of another type of anastomosis. So again, it's the connection of tubes. So if you hear it referred to other than in terms of blood vessels, now you know what. Okay, but back to this, we are talking about blood vessels. So what this does is it provides an alternate route for blood flow. So arteries do not form anastomoses, are called end arteries. If an end artery is blocked, blood can't get to the particular region of the body, and necrosis can occur. In other words, the tissue can die because we don't have enough blood flow to that area. Remember when I talked about the heart And I talked about like the anterior descending artery, or what we call it now, the anterior interventricular artery. Well, in the back of the heart, we have a posterior interventricular artery. Sometimes those arteries can come down and connect and create an anastomosis, which is going to help give collateral blood flow to the area. So if one area is kind of reduced in blood flow, the other area can supply some blood flow to that area. And sometimes that happens when the patient does start to get some narrowing of the vessels. New vessels start to grow and they can connect to one another. And again, create an anastomosis. Capillaries, again, are one cell layer thick with a basement membrane. The inside is the endothelium. And again, it's simple squamous epithelium. We want a single layer thick because it's at the capillaries where gas exchange takes place, nutrient exchange takes place, and waste products are able to move out of the tissues and into the blood to be gotten rid of. And so we want these extremely thin. Again, pretty much one cell layer thick with a basement membrane. So capillaries are microscopic vessels that usually connect arterioles and venules. So again, we have artery, arteriole, capillary, then venule. And capillary walls are composed of a single layer of cells and a basement membrane, as I mentioned. And because their walls are so thin, capillaries permit the exchange of nutrients and waste between blood and tissue cells, as I referred to earlier. So capillaries branch to form an extensive capillary network throughout the tissues and are found near almost every cell in the body. And so we have this vast capillary bed. And one way that we can regulate how much blood flow goes to an area is through these precapillary sphincters. If an area of the body doesn't need as much blood, or let's suppose it's some skin that's getting a little too cold and we want to maintain that body core temperature, these precapillary sphincters can constrict down and shunt the blood away from, if we're talking about skin, shunt it away from the skin and keep that blood going toward the core of the body. Okay, but I mean, this can happen in other situations as well. For instance, in a sympathetic response, do we want a lot of blood flow going to the intestines? Remember, the sympathetic is the fight or flight. No, we don't want to digest, and we don't want a lot of blood flow going to the digestive tract, so we'll shunt some of that blood to the muscles to where we can use those muscles to run or get out of there. Okay. But during digestion, okay, during a parasympathetic response, the rest and digest, we might shunt some of that blood away from the muscles and put it more toward the digestive organs. Okay? And so one way, again, we do that is with these precapillary sphincters. Now there's different types of capillaries. This one's a continuous capillary. Think of it as like a garden hose. Okay? So this one is continuous. There's no gaps or anything in there. One thing that'll create gaps in there, remember we talked about histamine. Histamine can create little gaps, but typically it's a continuous capillary. And you can see that, again, we have the lumen, which is the opening. We do have these intercellular clefts, which typically keep fluid in. Okay, we'll learn later that that fluid that gets to the tissues can get forced through these intercellular clefts, but typically it's held in place by albumin in the blood. And we have the basement membrane on the outside, and then we have the nucleus of an endothelial cell. Now this is a fenestrated capillary. Fenestrated capillary, I don't know if we have any gardeners out there, but there are these hose that you can put in the garden. They're called soaker hoses. Okay, when you run water through them, unlike the regular garden hose that keeps the water inside, the soaker hoses kind of weep water out of them the entire length. Okay, so they have very fine pores, and that's one way you can water a garden without spraying the water off into the air. Okay, so there's your gardening lesson for the day. So these fenestrated capillaries are very similar to that. There are more fenestrations or holes that we find in the wall of this type of capillary. Again, fenestration means hole. In this case, a pore. And what's a pore? It's a hole. Okay. Now, keep that word in mind because when you work with patients that have tracheostomy tubes, some tracheostomy tubes are a solid tube. Some, though, are fenestrated, which means it has a hole in the top. So if the patient still has vocal cords, they can put their thumb over the hole on their neck, and then the air will bypass that hole and go up through the fenestration so that they can use their vocal cords. And then we have the sinusoidal capillaries. Now these are the most leaky of the capillaries. They have incomplete basement membranes. They have very large clefts, very large holes. Okay, so they kind of look moth-eaten. All right, and so that's going to allow for more fluid to get to certain tissues. Okay, veins, as I mentioned before, we have the tunica intima, which has the endothelium. We have a basement membrane. We have the tunica media with a thin, smooth muscle layer, and the tunica externa, which is mostly connective tissue. And then we have our valves here. A lot of times if you're trying to take blood, I don't know if anybody out there does any phlebotomy, but occasionally when you put the needle in, you know you're in the vessel, but for whatever reason, no blood is coming out. Well, sometimes you're right up against, let me get my arrow back again, there we go. We're right up against the valve, okay? And sometimes if you pull back a little bit, you pull away from the valve. Sometimes you might push through a little bit, you're pushing through the valve, but a little better to pull back, and sometimes that unplugs the end of the needle, and you start to get blood again. Now, venules are small vessels that are formed by the union of several capillaries, and venules drain blood from capillaries into veins. And veins are going to be formed from the union of several venules. And compared to arteries, veins have a thinner tunica intima and a thinner tunica media and a thicker tunica externa. And veins have less elastic tissue and less smooth muscle than arteries. And again, they contain valves. So if we look in, we can see the valves of this vein here. These are the cusps of the valve. Here we can see it on the side. Very delicate. Also, the one thing I want to mention, since they're showing the inside of this vein, the veins and the arteries are going to have a very smooth endothelium. And again, that just, it's kind of a non-stick layer, and it keeps blood vessels from sticking and then creating a clot. Distribution of blood at rest, the largest portion of blood is in the systemic veins and venules. And so this acts as a reservoir. So systemic veins and venules, blood reservoir, 64% of the blood is there. As a matter of fact, if somebody is going into shock, we can put something called MAST pants on them. MAST is M-A-S-T, stands for Military Anti-Shock Trousers. I don't know how often they're used anymore, and I know there's more portable solutions than that, but they act the same way. In that if we put these trousers on and then inflate them, it squeezes the legs, and we can get more blood up toward the brain and vital organs, because the legs have such a tremendous venous reservoir there. And again, that's one way. If somebody's blood pressure drops very low, we can use those to bring the blood pressure up. Okay. And so looking at the rest of it, the pulmonary vessels contain 9% of the blood, heart 7%, systemic arteries and arterioles 13%. Compare that again to the veins or venules at 64%. And then our systemic capillaries, even though it's a pretty huge capillary bed, is only going to be 7% of the blood.